Hello, this is Brandon Leonard, Director of Strategic Initiatives with Men's Health Network, and I'm here at the Dialogue on Men's Health meeting discussing best practices in men's health outreach. And I'm very pleased to be joined by one of our participants, Darryl Davidson, who is Director of Men's Health at the City of Milwaukee Health Department. Darryl, thank you for joining us.
Hi, Brandon.
Darryl, can you tell us a little bit about the work that you've been doing over the course of many years to do health outreach to men?
At the City of Milwaukee Health Department, our goal is to assure that men not only receive the services that they say are important to them, but we also want to make sure that they're personalized. And by doing that, we had to first ask them a series of questions on what they would want in a men's health center. So our first program started off as a men's health center that was a one-stop shop. That allowed the men to have resources available to them where they were directed to neighborhood services as well as professionals who worked with educational services and were able to help them get jobs in some cases too. Then we could address their health needs after they got the other things taken care of.
Can you talk about some of the strategies that you have employed, first of all, to bring men in, to make them aware of your services, and then to work with them, particularly some of those men who maybe traditionally wouldn't have come in or sought those services?
We usually promote to men who are low income and men of color, and so we've been using images of men who are Black, Hispanic, Asian descent. We have a variety of methods where we get the information to them. We have been using social media, so we've been using the assistance of some of our partners' Facebook pages. We have a large men's health referral network where those individuals have the resources to assist us with getting our messages out. We also have been able to do outreach through our fatherhood partners. So for example, we have a large fatherhood summit where we're the ones who put together the health component. And we've been able to attract the men because they receive services in child support as well as with legal activity. They might even be able to get opportunities to advance their education or get help for getting a new job. And then when they're able to see us in our settings, such as our men's health centers, we're able to introduce them to a male-friendly environment. So we have posters and magazines and images that have a male theme. And all of them seem to like that part. And fortunately, we were able to get people to paint the walls. The walls are painted in blue and darker colors. We have images of boys and men who are happy. And we have proverbs and sayings on the wall that inspire men to improve their health.
That's excellent. Those are some strategies that I think other folks could learn from as well. And I also was curious about today's discussion. We heard a lot of strategies from other folks around the country who have developed and are developing successful men's health programs. Was there anything that you learned today that you think you'll take back to apply to your own program?
Well, I know that there's an emphasis on family and community health, and I want to make sure that we include men in the family focus. So people were saying that men have been excluded and they've been left out of many of the environments and the information that's being shared. I want to make sure that whatever is being shared with other people in the family, the children, the moms, that the dads get that information too. So I'm committed to bringing that back.
Well, Darryl, we want to thank you for your continuing participation in the Dialogue on Men's Health series, and thank you for taking the time to speak with me afterward. Thank you for sharing all the things that you've learned and all the great programs that you're doing in Milwaukee.
It was a pleasure, and thank you, Men's Health Network.